Angela Dowling knows insurance.
President of Regents Blue Cross Blue Shield, here for the Oregon plan.
She's watching the COVID-19 vaccination process play out.
What does that really look like from an insurance perspective?
Well, the vaccination itself is free. The federal government is providing coverage for that. But for those providers who are there helping you get the shot, the people who are putting the shot in your arm, there is a cost for administration.
So basically, the government pays for doses, and your insurance helps medical providers get reimbursed for their time and resources. And if you don't have insurance, no problem. You still get the vaccine.
Herd immunity is important. We just need to make sure we get as many people vaccinated as quickly as possible.
OHSU also told KGW patients will never be turned away if they do not have insurance, and patients themselves will not pay for their vaccination visit. And even if you have insurance that gets billed, you will never see the cost. So why bother bringing the insurance card?
Why is it important to provide the insurance information? How does that help the system that we're all trying to get into for this vaccine?
And it's important for us as insurance companies to know who's received their immunization and who hasn't. If you haven't received your immunization, we'll make a point of trying to reach out to you, encourage you to get that shot as well.
For those without insurance or even ways to get to a vaccine appointment, she recommends mobile community clinics.
Look for those opportunities where clinicians are actually coming to your communities.
Like those run through Medical Teams International, a group traveling around and administering the vaccine for free with help through Regents. The goal is simple:
making sure that everybody gets vaccinated
to reach that immunity finish line. Galen Ettlin, KGW News.